25 years ago, we would never have dreamed about what we're seeing today.
We weren't actually doing ovarian cancer research at the time until I got this funding from the OCRF. And if I hadn't have got that, honestly, the project wouldn't have got off the ground.
OCRF is just fundamental for us, fundamental since the day one.
Without the OCRF, I honestly feel I wouldn't be working in this area.
There is a vision there. They've got strategies put into place. They think long term.
And knowing you have that behind you to do your research is really inspiring.
They are just remarkable people that are just working tirelessly.
I really wanted to be a part of that positive change.
All this happened in the last 25 years with the support of the OCRF.
It was a really interesting time. I was a wide-eyed PhD student. I was able to attend some meetings with some of the most respected ovarian cancer researchers in Australia. I was really privileged to be the first PhD scholarship holder from the OCRF. The research area that I work on is a rarer form of ovarian cancer known as granulosa cell tumours. My mother-in-law passed away from ovarian cancer. It really brought home to me how raw a disease this is.
I've actually always known that I wanted to be a scientist. My beautiful mum developed breast cancer when she was very young. She was 34.
I grew up with my mother, my grandmother, and my great-grandmother. So, I'm kind of the product of three very strong generations of women. That is one of the reasons that I focus on women's health as well.
A lot of the national funding bodies tended to ignore ovarian cancer.
So the nickname of ovarian cancer is the silent killer. Usually when symptoms show up, they are not specific at all. Can be many, many other things.
But if we think about it in a different way, it's silent because we're not actually talking about it.
Ovaries aren't really something people talk about. So if you don't speak up, then how are other people going to learn?
We should have the right to be able to fight this disease. Why are we any different to any other cancer? Why have we been overlooked?
We really needed a funding body to step in dedicated to this type of research.
There are no early detection tests for ovarian cancer. There are none. So everything started 8-9 years ago. My research program focused in develop early detection tests. Just we have an idea to identify that signal coming from the tumor cells. And we present this idea to the OCRF, and they were kind enough to fund the initial project. One of the more attractive things about the foundation is they're willing to fund ideas.
Discovery research is hard, but it's high risk, high reward. But that's why organisations such as the OCRF are so important, because they're willing to put it on the line and give people with out-of-the-box ideas money to actually try this project. So my project was based about how can we take out the tumours rather than have them grow back and be resistant with a specific type of drug called a PARP inhibitor. If it works, it honestly will change the course of how ovarian cancer is treated.
My interest has always been in the immune response and how that could be trained to recognise and fight cancer, and that's essentially what a vaccine does. We just need that research and that understanding to work out how we can harness that better. Any complex problem like ovarian cancer needs a complex, multi-pronged approach to deal with it. You want to look at the complex problems, and they're challenging. Bring it on, yeah.
The momentum has been sort of snowballing, if you like. With the advance of genomics, with the advance in proteomics and medical imaging, we really see this tremendous coming together of minds. Australia's led the way, and then all of a sudden you're sort of seeing certain bodies around the world come about. It needs to be collective. It needs to be done worldwide.
I love to go to the OCRF. I go to to the community to inform what we're doing, because we get feedback, and then you see faces. With every single woman that we met that suffered from ovarian cancer, there's a story behind that particular person and their families.
I became involved with the OCRF when my wife Leanne was diagnosed with ovarian cancer and had a 6.5-year battle with the disease, and incredibly sadly passed away nearly 2 years ago. Becoming a carer was hard. You go from being a partner and an equal to then being a carer and a psychologist and a chemist and a nurse. I've created friendships through the OCRF of other men and other women that have been through the same situation. And there's something very comforting about sharing your story, knowing you're not alone, having someone that can really relate to where you're at. The girls are determined that they want to make sure Leanne's remembered. As soon as Leanne passed away, the girls signed up to become ambassadors.
I think when I started, there was like 2 other ambassadors and myself, and I was by far the youngest, and they were so supportive and like helped me with the tips and tricks of how to be an OCRF ambassador. And it's not only just about raising awareness for ovarian cancer, but I really wanted to help other women feel more empowered. I always feel supported and loved, I guess. But it's hard as well because you lose friends.
It's frustrating because we've lost so many great ambassadors, so many voices. Because of the lack of funding, they lost their lives too early. You know, they weren't around long enough to see the next best thing. We have got the funding from the White Shirts campaign, for October, and now the Mother's Day Classic.
When I did the White Shirt campaign, honestly, I've never felt so appreciated. It was unbelievable. I would meet complete strangers who would come up to me and go, "Thank you."
Meeting those people, hearing their stories really sort of drives home to you what you're doing it for and that motivation and the why.
Being part of the Lived Experienced Advisory Panel is amazing. I get to see such amazing research projects. Even like the researchers who become friends with, and all the amazing people that work for the OCRF, like people like are very passionate about it. So yeah, it's great to be a part of.
I think that this community is very unique. We're all fighting a common cause. So I really, from the heart, want to say thank you. Your voice, your advocacy, your strength, even through times of grief and hardship, have really built this momentum, and it's something that we bring every day into the lab. And I can't thank you enough for trusting us in what we do.
We are doing our damnness. We are throwing everything we can at this, and we'll endeavour to deserve that support and funding, and hopefully be able to deliver you with some really impactful results and data.
We have been making a lot of progress from the last 10 years in early detection of ovarian cancer. They are not alone. We're doing our very best to bring that hope to all these women that suffer and their families that suffer from this terrible disease.
It was a great honour that I could be involved and continue to be involved today and will be into the future.
To get anywhere, it requires research, and it requires money and people and talented people and time with passion, and we will get there.
I want to be alive to experience the next treatment, to live longer, to see the next best thing, to see the fruition of all this amazing research and the work that OCRF have put in. I want everyone to rejoice in that joy of when we reached that end, the end of ovarian cancer.